Well, I'm absolutely delighted to welcome today's guest, all the way from over the Atlantic, Nicole Waterhouse, CEO of Alpha Health. Great name, by the way, Nicole.
Thank you.
And welcome to today's show.
Thanks for having me, Russ. It's nice to be here.
Absolutely. And we met recently, didn't we? We met over in Phoenix at the Silverback Summit. And I sort of came across you, and as you were in the middle of a conversation talking about the difference between men's and women's health. It was really
Mhm.
funny. That was like our introduction to each other.
It was.
And you were saying basically, men are easy, women are
Absolutely. I stand
difficult.
by that.
Well, perhaps we can dive into that a little bit later. But to start with, if people haven't come across you yet, um, who is Nicole Waterhouse? What is Alpha Health, and how did you end up in this space?
Perfect. Fantastic question. So, my name's Nicole Waterhouse. I am a nurse practitioner. I'm a doctor of nursing practice. My background is in emergency medicine, which I've been practicing for 17 years as a nurse originally, and for the last 10 years as a nurse practitioner. I would say about 7 years ago, I became interested in the preventative medicine space, functional medicine. Learning conventional medicine for so many years, it's we do things differently now in functional. Really the prevention side is my biggest interest, which is why I started Alpha Health. I know hormone replacement for me. I am someone who uses hormone replacement therapy and began about 5 years ago, and it made a big impact. It changed my life drastically, and I wanted to help as many people as I can feel the same.
Yeah, I love that. And I hear that story so often. And it was my own journey as well. 10 years ago, starting TRT, it transformed my life. The difference, I guess, is it took me 8 years before I found my voice, because I had 8 years where I was kind of like scared to talk about it, really. And I felt probably a little emasculated, like, man, I
Right.
need to take something extra to make me feel like a man. Like, and it took me 8 years to talk about it. So you were way faster.
Yes. Yeah. Right away, I was like, why is everyone not doing this? Right. That is, there are so many, it's multifactorial, I think, and I'm sure we'll dive into the reasons why and why medicine as a whole, we're not seeing much of the prevention here in the US, at least. We're still practicing in kind of we're band-aiding model, conventional medicine model of this is how we've done it the whole time in a sick care system without really looking at maybe if we just prevented some of these chronic disease states, we wouldn't be where we are today.
Yeah, it's great. It's crazy, isn't it, to think that doctors, health professionals aren't taught even about nutrition,
Yes.
like when they go through their studies. And you're like, wow. I actually spoke to a GP here in the UK recently, and she said, Ross, just just started learning about this incredible cutting edge area of medicine. And I went, wow, tell me, what is it? And she said, it's called lifestyle medicine. And I was thinking, is she joking? And she went, it's about nutrition and exercise, and you can prevent a lot of things.
Yeah.
It's like, oh my God, you're being serious. And I actually spoke to another doctor quite quickly afterwards. And I told her this story, and she said, I know. To think there are people that think this is new. I was on the first course that was almost 10 years ago now.
Yeah,
I was
yeah,
like, okay, this is like thousands of years old. This is basics.
right.
Like, but wow, this is modern medicine.
Really is. It's amazing, and I think finally it seems that people, I would say since COVID, probably, everyone started to take a real deep dive into okay, what is going on? Can we prevent these things? We realized, right, like everyone that had unfortunately the virus, so many the patients that did the worst were had most of them had a lot of these other chronic illness states, diabetes, morbid obesity, heart
Yeah.
issues, renal issues to begin with. So how can we prevent those chronic illnesses so that people are healthier overall and their immune system's functioning well, their hormones are functioning well, their just body is, their metabolism's working well, you know? So I think now everyone is taking a deeper dive into nutrition and prevention and exercise, and how these specific pillars really have to be put into play to have overall optimal wellness, right?
Yeah. We're in a time of, I think, real polarity in the world, because you do have more interest, I think, and I agree. It was post-COVID, people became more aware of their own mortality, of
Mm-hmm.
immunology, as you say, wanting to be healthy, because there was this, the average, I think, was 5.7 comorbidities in order to be, fatal with COVID. So people became a lot more aware of this, but the same time, we've never been more unhealthy as a people.
I
Like
know.
60% obesity, crazy rates of chronic illnesses. So we've got this polarity. We've got, on the one hand, people like yourself talking about how, we need to prevent rather than cure. And then you've got people at the other end who are just, eating fast food every day, have no intention of exercising, don't even know why they should.
Right. I know. I agree. It's tough. We see this at our practice frequently, you know. I mean, we do whole health optimization, and hormone replacement is kind of our main focus, because truly everything is hormones. When you dig really deep into it, hormones, oh my goodness, they're everything. But we do a lot of weight loss as well, and lifestyle management. We go over diet, nutrition, exercise. We use some peptides as well, but the main focus is mindset too. It's helping the client develop that mindset for, okay, you can do this. You really can. Like, helping them to believe, prevention, and working on everything with them. Okay, what are the steps? How are you going to do this every day? What are we going to do? Let's make some actionable steps, measurable actionable steps, so that we can achieve your goals, right? And whatever those goals may be, to help them dream big also, But with the weight, that's a tough one, because you know so many people think they could just take a medication now with these new medications that we use, and we implement a lot of GLP-1s in our practice. But I will have to say, there are a lot of clients that think, you can take a medication, take one injection weekly, and still eat anything you want.
Yeah.
That doesn't work that way, right? It's a tool in a toolbox, but we have to implement each of these tools to get the outcome we are looking for, I think.
I love that. And I love the fact that you address mindset, because I think that's one of the key things that's often missing. If you don't have that nailed down, you're going to fall back into old habits. And I did a podcast earlier, hasn't come out yet, with a special forces gentleman from the UK. And we talked a lot about mindset. And actually, he had a thing which was, rather than say, I have to do something, say, I get to do something. So
Yeah.
instead of I have to go to the gym, it was I get to go to the gym, or I have to go to work. I get to go to work. And this shift in mindset, he said, was really, really powerful.
Yeah, for sure. Absolutely. Mindset really is everything. Mindset, if you think you can, you will, right? And that can go in a positive. You can do it. Thinking you can, you will be able to achieve that goal. But also, on the flip side, thinking you can't do something, which we
Yeah.
see frequently. I mean, this mindset of I can't, I'm not sure, I don't know, the fear mindset, and helping clients overcome that is one of our greatest challenges, I think.
Yeah, I love that. The first book I actually wrote, which was many years ago now, the very first line in it was, whether you think you can or think you can't, either way is true, which is, of course, a famous Henry Ford quote.
Yeah.
And it's so true, and that's what we're talking about now. So yeah, I love the fact you talk about that. Do you start there, or do you bring mindset in later?
Um, I do start there initially. Upon intake with our clients, they fill out an intake form, and that's before anyone even sees them. So once I establish contact with the client, I already have that filled out form to kind of get an idea of where they stand and go over, a lot of the questions involve mindset and, goals, mindset, you know, looking at past habits, maybe self destructive habits that they may have, past medical history, of course, but mindset's one of the big ones because we have to know what kind of person is this? How are they going to learn? How can I help to, intervene here? And everyone's different. Um,
Yeah.
I'm a professor. Well, I was up until May of this year at Rutgers here in New Jersey. And, one of the things we learn is teaching styles, right? And everyone is a different learner. So whether you're an audio learner, visual, tactile learner, if you're someone who has to, for myself, I need to hear something, see it, and then write it to truly, absorb the information. It's a little much, but everyone learns differently, right? So even our school system, elementary school, if we're teaching this old way of schooling, which is you sit down and someone writes on the board, not every child is able to sit through the school that way. So now we're trying to learn, I think, and implement different ways of teaching for different students in the learning style. So I
Yeah.
use the same idea kind of with our clients here.
Brilliant. Yeah, I remember going to university and sitting through lectures, just thinking, what was that all about? And then I'd go and talk to the lecturer and get to
Mhm.
have that dialogue and ask the right question that I needed to make it make sense. And I go, oh, is that it? Like, why did it take us an hour of talking about that? We could have just done it in 5 minutes. Like,
Right.
that's how I learn. It's like this one-to-one conversation. It just goes in faster.
Absolutely. Yep. I
Do you
agree.
ever have any clients that you're working with and they say, why are we bothering with this mindset stuff? Like, just give me the drugs, like, and I'll be gone.
Oh, all the time. I have many clients that way. It's something that we have to continuously reinforce, honestly. On the initial in when they come into the office and I spend probably a good like 90 minutes with them initially, and we review all their lab work and go through everything. And everyone's so excited when they leave and they're like, okay, I'm going to do this, and we get them all amped up and we talk about mindset and how we're going to change their behaviors with these actionable steps and these small goals that we can measure. And then when we reevaluate the next month, okay, let's add a little something on, right? So I really am someone, I like to do things in a stepwise pattern. And a lot of these clients, right, they've been following this self-destructive pattern for so long that attempting to change everything about their life in one at one time in 1 hour, it doesn't work for them, right? So I use small measurable goals and we change something every month. So whether it be, okay, we're going to have you wake up an hour 30 minutes early to exercise because exercise is a huge pillar of wellness, right? We know how important exercise is, strength training, muscle development, all of that. Not only does it help physically, but it helps our immune system. It helps the way our metabolism works. It helps the way our body functions. And number one, it helps here, right? I mean, that's the best thing about exercise, how good those endorphins feel after exercise. Um, so what we may do that, we may implement that one change. And then in a month, when we reevaluate, okay, how's it going? We make sure they journal, we're keeping track, and great, we conquered that, we achieved that goal. Let's build on that. Now, what are we going to do? Okay, water, let's drink more water. Let's, whatever it may be, read 20 pages a day of a book, which we try to, implement various strategies to help just for overall wellness and feeling good.
I love that. Yeah, so you're going way beyond
Mhm.
allopathic medicine now. You're
Yeah.
and beyond just preventative
Yes.
into the holistic,
Yes.
mindset, reading a some sort of non-fiction book. I'm
Yeah.
guessing.
Yeah.
Um, Brilliant. Absolutely love that. And
Hmm.
to go back to something we said at the beginning, then, what are the differences between men and women?
Okay. So men and women, in regards to hormones, men. So initially, when I
What about,
opened,
sorry, what about, like, do men or women follow that advice better than others?
that's a good question. I would say I don't know if it's dependent on sex. I always say men and women think they should compete, but we actually should complete one another instead of compete with one another.
Yeah.
And for men, I would say most men, it depends on the man and it depends on the woman. I'm going to stick by that. Totally depends on the person.
Sitting on the fence.
Yeah, on the fence. I'm staying here.
We're definitely complementary opposites, aren't we? We should celebrate the differences. We're not equal. We're different, but we're complementary.
Absolutely, for sure. We need each other, right? And it's important that we accept that the feminine role, the masculine role, and how they fit together. It's hard in our society now because I don't want to go too deep into this controversial topic, but
Go for it. I love it.
do it. Go for it.
Yeah.
I don't know, with everything, and it's just there's so much gray area now, and I think the world is in a real tough spot now. And sometimes maybe if we look back and think, okay, maybe we should get back to our roots and okay, let's really look at things historically and what worked and what didn't work and make things better from there.
Yeah. A lot of what our grandparents said were great advice, wasn't it? Eat your greens, exercise, get outside for a walk. You're not a pirate, you're a little boy or whatever. We're not going to chop your leg off just because you said you're a pirate. So why would we do anything else?
There you go.
It's just old-fashioned ethics and the way we lived our life. There's a lot of that just I think makes sense.
Nature makes sense sometimes.
Exactly. And now it's difficult. I feel sorry for young men now in particular.
Yes.
Because a lot of them don't want to approach the other gender because they're not sure there is the other gender, for one. They're like, man, what if I get their pronouns wrong? Maybe it isn't a woman, it's something else.
Yeah.
And then they're like, well, what if that's construed as aggressive or toxic? Because I've taken the first step. Because now we've horribly put these two words, toxic and masculinity, together. Which there are toxic traits, but it's not anything to do with masculinity.
Right.
I think weak men that are toxic.
Absolutely.
But equally, there are toxic women. It's not gender related, is it?
Right. Not gender related. Another thing.
Yeah, absolutely. We went off on a bit of a tangent there, but I love this topic as well.
Okay.
It's
I do.
topical, and there are I think a lot of young men who are really struggling at the moment.
It's rough, and I'm in my 40s and I understand being a strong-willed alpha female. I mean, the name of my actual clinic is Alpha Health. So I'm a female, right? So people say, like alpha, you're a female. A lion is a male, right? And is a male, it's not a lioness, it's a male, our logo, but it's just a symbol of power and a symbol of kind of being that alpha leading the way. And I think being a female that's a strong alpha female, it can be for sure intimidating to men at times. And I'm not sure if many women have taken this role on because of the lack of male masculinity, the men that, as you're saying, they're nervous to, really kind of hone in on their masculine traits because they don't know if they'll be in trouble or they're unsure or it's tough. I'm not sure what happened with the feminine masculine role, why so many women now are taking on the masculine role. I do know myself, speaking just for myself, chivalry should not die. I love a man that opens the door, that likes to pay, that likes to drive, takes control of the situation. Even as the alpha female, I would much rather be with someone that was taking that, like letting you be in your feminine, that's super important, I think. So
yeah, I'm glad you raised that because I was about to say that because as a strong woman, I was going to say, do you want someone still to allow you to then fall back into your feminine side?
For
and
sure.
You just hit the nail on the head.
But
because
that's hard that's hard to grasp, and it's just the switch of gender roles, and it makes things a little bit confusing at times, I think.
Yeah, definitely. I think men should open the door, walk on the outside of the pavement, hold the chair out, pay the bill. But there are lots of younger men that I think are like, oh, I don't want to be seen as, competitive or aggressive or overstepping the mark. And you're like, no, that isn't the case.
Right.
Like, you're protecting, nurturing, looking
Right.
after the person, not because they can't do it, but because you want to, because you care about them.
Yep. Absolutely. For
It's a
sure.
crazy, crazy world.
It is.
Anyway, let's go back to health
Yes.
and then that little rabbit hole.
Love it.
Let's get back to men and women then. And again, one of the very first things I said, you said men are easy, women are more difficult.
Yes.
What did you mean by that? Because that was particularly about hormones, wasn't it?
Sure. Yes. We were discussing hormones at the time. Men, we're balancing one hormone, testosterone, for the most part. Of course, we are looking, at least in my practice, we're looking at other things, DHEA, pregnenolone, many other hormones. But for the most part, when we're talking sex hormones, testosterone for men, right? So we check a male's level, it's low, they have symptoms that coincide. Great, we're going to treat them with TRT. 9 out of 10 times, they feel amazing. 8 weeks later, they're flying high. They feel great. Their energy's back, mental focus, energy, libido. In every way, it's just much easier to balance that one hormone, right? It just is. With women, we have to balance. It's like a symphony. We have to make sure everything is playing to the proper melody, right? And it's tough with women sometimes. Everyone's different. Our treatment plans, it depends on your levels, your symptoms, how are we treating you, what form of, hormone are we using, oral, an injectable, a patch, a cream. Like, there are so many, it's multifactorial, and there are so many variables. So we want to make sure to balance our, progesterone, our estradiol, and then our testosterone. And we frequently do, follow up. So we'll treat kind of, usually in my practice, we'll start on the lower side and we'll slowly titrate up. We don't use pellets, because I don't love pellets, just because I can't, um, you know monitor. There's nothing I can do about the dose, right? It's like you put the pellet in, there they go, and I'm just going to end up treating their symptoms if they have negative side effects. So I do initially like treating with hormones that I can control. So whether it be injectable or oral or transdermal hormones, that's what I use specifically. But for women, yeah, we check their labs after 8 weeks upon starting. How do they feel? Number one, how do they feel? So I do not treat only based on numbers. I treat based on symptoms all the time. And we just use the numbers to kind of guide our practice. And usually after the 8 weeks, we'll increase the dose. How do you feel? Okay. No side effects. How do you feel? And we'll slowly titrate and dial the client in until they feel amazing and with zero side effects. That's what we look for.
Brilliant. And how do the psyches and emotions play into this from the two sides again? If we just say, if we agree there are two and we're going to go male and female,
Right.
Yeah, how does that play into it? Because again, we talked a bit about this. Men are easier.
Mm-hmm. I mean, so for the majority of the men you treat with testosterone, they leave, they don't have any complaints. You see them on their follow up. I mean, the majority of men, this is how it is. Women, they, as women, I think we dive deeper. We think about things longer. Our emotions are involved, and hormones are emotions, right? So what we're treating with hormones, it could change. Some people may have some initial fluctuations. Most feel great. They feel amazing for the majority. But there may be some that, might feel, they may be going through changes. So they'll call, they may, they'll frequently reach out. We have, we have many touch points at our practice though. So we contact them frequently for follow-ups, but I would say women, it's a much more hands-on approach that's necessary, required, and really just going through, okay, this is normal. You may experience this. You may feel this. You may have, our postmenopausal patients, and we start them on HRT. It's not infrequent that they may have, an episode of spotting or bleeding for a short period of time. that's not abnormal, we have to explain these risks, they're not really risks, possible side effects,
Mhm.
so they understand what's normal and what's not normal and how we monitor that.
Yeah. But I'm obviously looking at this as an n=1, because I'm thinking about this from my own relationship, my own hormones, and my wife.
Right.
What's really interesting is she will know if my hormones are out of balance 2 days before I will, because
Yeah.
she's like, "There's something wrong with you," and I go, "No, I'm fine." The general male answer, "No, I'm fine. There's nothing wrong." And then 2 days later, I'm like, "Oh no, she was right," because she says, I just get that little bit more distant, and something's out of balance. Now, thankfully, that doesn't happen very often now because I'm been after 10 years. But
Yes.
10 years ago, she would be, I was like this, peaks and troughs and up and down, and she would know well before I would that something was wrong. But since then, my levels are so stable. I don't go up and down very often. Joanne last year started having her own hormone issues,
Okay.
and the highs and lows were so much higher and lower than mine. So it was interesting to see. And again, that is an n=1. I'm just looking at two people, but the difference of male and female was huge.
Yes, absolutely. How is she feeling now?
Brilliant, absolutely brilliant.
Good.
Obviously, we were fortunate to have amazing doctors on hand. So she did go to the NHS first and was given awful advice. I said, "Look, we've got our own doctors. Don't go to the NHS.
Right.
Speak to our guys." And they said, "Do not do what you've been told to do by NHS. That's going to make you worse. Do this." And we hear that all the time.
I see that all the time. It's so unfortunate how many providers are extremely uneducated in hormones, even the ones that should be. And you're surprised. Oh my goodness. I mean, my background in emergency medicine is one thing, and once I dove into this, you know, hormone learning hormones world, I was trained by World Link Medical Neil Rousier. So he's like the grandfather of hormones. He's been doing it since the 80s. Dr. Morgenthaler, he's a urologist from Harvard, and I trained in testosterone replacement therapy by him. Um, all the gurus around the country going to frequent conferences, learning from the best of the best. And it's important that we do that because medicine, as we know, is an ever evolving thing. There's a reason it's called practice. It never ends. We never know everything. We're only always learning. And frequently people will ask me, what do you think about a specific topic, or how do I treat it? What I think of anything. And I'll say, this is what I believe right now, but I'm not sure how I will feel in years from now. We may know more. My opinion may change. And I think that's all, having an open mind and being open to understand. You don't know everything. It is important to continue your education and continue to learn the newest evidence-based approaches and what works best for the majority of clients, right? And that's what we do here. And I'm huge on education for my staff, constantly sending them to learn the newest and best ways, and networking, learning, meeting people like how we met at the Silverback Summit. It's fantastic meeting like-minded individuals, and we all learn from one another, really.
Yeah, most definitely. I was really lucky to meet the doctor I did like 11 years ago now, who even back then was like, "You need to be on NDT," because I tried someone to put me on levothyroxine in the NHS first. I felt awful.
Yeah.
He was like, "You need an NDT." The NHS said that's hocus pocus voodoo stuff. Don't do that. And he put me on NDT and TRT like a decade ago, and was talking about the interaction between those two hormones 10 years ago. And I was so lucky to meet him. He was like ahead of his time, which was amazing. But I think what's important, as you just said there, is we are always learning. Science is about pushing the boundaries, finding out new things. We never know it all. And I guess to come back a little bit onto the topic we talked about before, at the moment, the word science has almost been armored. It's become like, oh no, that's science, you don't question it. And that's not the case. It means to question.
Mm-hmm. It's 1000%. I couldn't agree more. I mean, I feel literally 5 years ago, it was this huge wake up. Well, 4 years ago, I'd say, when I began really diving in and saying, wow, it's like began questioning everything, every single thing that I did, every way I practiced, every medication I prescribed. Why am I doing this? How does this work in the body? What is what is the, what exactly is occurring? Of pharmacokinetics, everything. And I'm like, that doesn't really make sense. Why? I mean, emergency medicine, we save lives, right? I'm not treating primary care. I'm not treating usually with like blood pressure medicine unless it's an acute like hypertensive episode. And then we're giving IV, medication to get the blood pressure down. But, you know, looking at statins, for example, right? A statin. So everyone, high cholesterol, every primary care doctor puts their clients, not every, the majority say, okay, statin, you need a statin, you need a statin. When you really learn about statins, and if we dove into how a statin works and the side effects and the risks of a statin and truly the data, which there's nothing that shows that a statin prevents primary morbidity or mortality. Like, but everyone's on them. Like,
Yeah.
why? Yet they do cause insulin resistance, and that's a problem in a population where we have the majority insulin resistant and pre-diabetic to begin with, obese clients. What are we doing? Right? So risk benefit and looking at the client's individual risks and treating that client as opposed to just following a blanket guideline. That's the biggest wow. Like, I can't believe it. It's like everything I've learned is not real. It's like, who is making this up? Where is this coming from? And it makes you question, and you hear of all these people with their conspiracy theories. Then you're like, wait, that sounds like that conspiracy theory actually might in fact be fact. So
Yeah. It's hard not to end up with a tinfoil hat on sometimes.
yeah,
But it's important to keep an open mind.
absolutely.
Some of those conspiracy theories do turn out to be true, not all.
Right.
I don't know whether there really are lizard people in charge of the world.
Right. Yeah, I don't know if I believe that one, but
Yeah,
I don't know. You never know.
But I'm actually a physiotherapist by training, by background, 20 years ago. And we used to get a lot of people through chronic problems, aches and pains, and nothing really worked. And then you went a little deeper and they were on statins. And you were like, have a chat with your doctor, but maybe come off that. And they're like, my joint pain's gone away. And you're like,
Yeah.
isn't that funny? And that happened quite often.
Oh yeah, definitely. The myalgias with the statins, it's no joke too. So
Yeah, absolutely. So what's next for Alpha Health?
wow, what's next? I mean, oh gosh, it really. What's not next for Alpha Health?
Are you
The sky's the
exploring
limit.
Yeah, I mean, I guess that was a little bit of an open-ended question, but obviously, I guess you wanted to scale and help more
Yeah,
people. But are
definitely.
you looking at adding in new things? So, rapamycin, I know some people are talking about. Is that something that you're looking at? Is that something that you might be in?
We're looking at more of a functional medicine, not just hormones, but dealing a little bit on the functional medicine side. I've trained, I've had a few trainings with like all in functional medicine providers. And, we are offering some gut testing. So that's kind of where we stand as far as looking at the gut and the gut microbiome and helping to treat the gut brain axis. Rapamycin, I've heard, I have not used it, but it's definitely something that's on the horizon for sure. And I'll be researching a little bit more about that and possibly implementing it. But I do appreciate so many of the newer, function, anti-aging, biohacking things that are out there now. It's tough though. I find it's like trying to kind of be. I feel as if we're in the weeds though. Like
Mhm.
what's you have to really dive into these things and see, does this really work? Let's see the studies. What does the evidence say? So
Yeah.
we'll see.
Yeah, it's interesting. You mentioned you do use some peptides.
Yes, absolutely.
Obviously, you mentioned GLP-1s. Which others do you
Yeah.
use, if any?
Sure. We use a lot of growth hormone secretagogues. So my favorite is CJC 1295 and ipamorelin. That is my go-to as far as growth hormone secretagogues. We also use tesamorelin a bit. That's kind of a newer one, and it's helps with fat loss as well, but it's a growth hormone secretagogue as well. Now we're trialing hexarelin. That's another one. I use a lot of BPC 157 and TB 500, which help with musculoskeletal pain, joint pain, aches. I mean, I have a lot of people on that. We call it a Wolverine stack. So the BPC 157 and TB 500. Have you heard of that? You know what it is?
Yeah, I love that. It's a great term.
Love it, and our clients love it. So I have one guy that he was told he needs a rotator cuff repair, and he doesn't want to stop working out and take the time off to have this surgery. So we trialed BPC 157 and TB 500. That was like 9 months ago, and he loves it. And he's like, I'm not getting my shoulder done. I'm gonna just use my peptides for now until I absolutely have to. So that's kind of nice. I like PT 141. So are you familiar with PT 141? It helps with sexual
No,
function, libido, male, female, helps orgasm for both. So you use it, it could be nasal spray or injectable, and you use it like 30 minutes, an hour prior to planned
wow.
intercourse. And yeah, it works pretty good for the majority of people.
PT 141.
PT 141, yeah. It's fantastic. There are some kind of nasty side effects some people experience, flushing, nausea, vomiting. So that's not fun,
Yeah.
especially when you're trying to get in the mood for intimacy and someone is nauseous and vomiting. Not great. But the majority of clients, I would say like 60% don't experience that.
Okay, that's really interesting. What are your thoughts on? You mentioned some of the human growth hormone drugs.
Yes.
What about just low dose HGH? Why go to a precursor or a component when you just go whole hog and go to HGH?
Yes, totally. I understand. So fantastic question. I think in my case, so human growth hormone, it is in the US. I'm not sure how it is in UK, but scrutinized. I mean, it's pretty tough to prescribe that. It's really frowned upon if someone has unless someone has a true growth hormone deficiency. So it's used, you know, for children, like young children that aren't growing appropriately. I think it's covered that way. We can obviously use it off label if needed. I do not in my practice prescribe growth hormone though. I use only the secretagogues. Now, most of my clients, I would say, are the majority of my population is between the ages of 30 and 70. The majority, there are outliers on either side, but most of my clients, the growth hormone secretagogues work great for them. Now, possibly if I had one of my older clients, 50s upward, 50 isn't old, but maybe 55, 60, 65, I might trial a growth hormone secretagogue, although it may not work as well. And then for those clients, probably HGH would be a good option for that person. But I myself try to stay away from it just because, unfortunately, already in our industry and what we do, a lot of what we do is pretty scrutinized, and we follow a strict, make sure the patient has symptoms, that they're a candidate for TRT. We're not treating anyone. We're pretty careful about the age range that we're treating. So growth hormone right now, it's just not something that we do in my practice, but I do see the benefit of it for some.
We're the same in the UK, so it is very much scrutinized, frowned upon. I guess a different question for you then would be, if it wasn't, would you use it?
Oh yes, I definitely would use it for sure.
Low dose, 5 days.
For sure, low dose. For sure, low dose, and it would be specific to specific patients. I don't think I would have a ton of clients on it, but definitely advanced age would be beneficial for, I think, clients with advanced age, no history of any types of cancers or anything that would put them at serious risk of like malignancy or overgrowth. That's something that you have to take into account. Even with my growth hormone secretagogues, if anyone personally, if I have a client that has had a recent history of any type of cancer, I won't use a growth hormone secretagogue on them. So
yeah, fantastic. Well, thank you so much for taking the time to talk with us today. If there are people out there who want to work with Alpha Health and Nicole, where do they find you? How do they reach out?
sure, fantastic. They can reach out to us via our email. So our email is our URL. So our website, it's njalphahealth.com, and they could click schedule now to schedule a 20-minute consultation. Another option would be texting us at 770-462-5742.
Brilliant. And if you're outside of the US, that's a +1 on there. We'll put all of these on when this goes out, probably next week. And just to finish off then, if there was one message that you could communicate to anybody watching this about their health and well-being, what would it be?
One thing I can communicate, I would say you can live a very long life with a healthy lifestyle, hormone range, and a longer health span. Really, it's not about lifespan, so amount of years. It's about how many of those years are we going to live a wonderful, independent, healthy, fruitful life, right? And it is possible. Women, I treat the majority of my clients are women, although I do treat men as well. But a lot of women don't realize that they can feel their best, have a strong libido, energy, focus, drive well into their 90s. And it's possible. So come see me and we'll show you how it's done.
I love it. Absolutely brilliant. Thank you so much, Nicole. I'll let you carry on with your day. Take care.
Fantastic. Take care, Ross.